Well, we now cross live to the State House in Abuja, where the coordinating Minister of Health and Social Welfare, that's Professor Ali Pat, is holding a commemoration of the 2023 Universal Health Coverage Day and the unveiling of the Nigeria Health Sector Renewal to improve population health outcomes by President Bola Ahmed Tinubu. Let's take a listen.
Bola Tinubu GCFR. Very distinguished senators here present, members of the House of Representatives, the Secretary to the Government of the Federation, His Excellency Senator Akube, the Chief of Staff to Mr. President, Honorable Femi Gbajabiamila, Your Excellencies here, governors from the states or your representatives, led by the Chairman, Nigeria Governors Forum, and Executive Governor of Kwara State, Malam Abdulrahman Abdul Razak. Honorable ministers here present, led by the coordinating Honorable Minister of Health and Social Welfare, Professor Ali Pate, and of course your brother, Honorable Minister of State, Dr. Alausa. Permanent secretaries, heads of department and agencies, heads of diplomatic corps and development partners, senior advisors to Mr. President and other advisors here present, commissioners from the 36 states of Nigeria, including FCT, my lords, temporal and spiritual, members of the diplomatic corps and development partners, Your Royal Highnesses, Your Eminence, the Sultan, the Khan President, captains of industries, members of the non-governmental organizations here present, and of course, vibrant members of the Nigerian media. I welcome you to this very, very special occasion in the history of moving health forward. One important thing to say concerning today is the fact that it is the first time it's happening in Nigeria, and today, as we mark the Universal Health Coverage Day, a few things that I'd like to say before we continue with the program. Mr. President, sir, I welcome you. I know that for you is an ambition about creating a $1 trillion economy in the next few years. And health will be of great contributor through employment, creation, poverty reduction, increased economic growth, and strengthening human capital to increase productivity of Nigeria towards contributing to economic growth that will culminate in achieving the $1 trillion economy. I salute you, sir. Your Excellency, Mr. President, I would like to call your attention to how health has contributed to the global economy in the last half a century, to the extent that more than 25% increase in life expectancy that has been recorded globally is attributable to improvement in health system. Therefore, it is important to set the stage for conversation to be able to link the achievement of universal health coverage and health investments to the economic development priorities of Mr. President and indeed this administration. It is the first time health insurance has been expanded to the poor and vulnerable in a party manifesto. It is also the first time it is seen as part of post-election policy agenda of the government. Therefore, Your Excellency, Mr. President, I would like to encourage you in my own little way to say, to maintain this path as it is on the path of creating history as the administration that will put Nigeria on the course of UHC trajectory. But the implementation depends on the buy-in of all, especially the subnational level. That is why the compact that we are signing today between the two tiers of government is very crucial. It is on this hope to renew, to rebuild, to make health the mainstay of our economy. Because, Mr. President, sir, the people that will drive the economy must be healthy herd of Nigerians. I welcome all of us to this event that will change history. My name is Mojima Konchola, and I'm more than excited to be part of this historic event this morning. You're all welcome. It is important for us to know that today we cannot afford to be miserly with our applause, because we are witnessing history. So can we have the, yes, I have Mr. President's applause as well. At this moment, Your Excellency, to please invite one of the dynamic duo that you chose to lead health and social welfare in this country. And I can assure you I'm a media person, so I know and I'm tracking what they're doing, and they're doing well so far. And thank you for the warning you gave that don't perform, you would leave. But these are performers. On behalf of all of us here, I'd like to welcome the Minister of State for Health and Social Welfare, Dr. Tunji Alausa, to welcome us formally.
Thank you, Auntie Moji. Your Excellency, President Bola Tinubu, GCFR, thank you, sir, for finding time out of your enormous and extensively busy schedule to come here today. We really appreciate your presence. This just continues to vindicate your commitment and your determination to fulfill the electoral promises, one of the major electoral promises you made to Nigeria, which was fixing the healthcare system in Nigeria. You said you will fix the healthcare system. Your government will fix the healthcare system. Not just fixing the healthcare system, but putting it on path of sustainability, decades to come, where every single citizen of this country would be entitled, eligible to meaningful and comprehensive health care. Thank you so much, sir. The Secretary to the Federal Government, Senator George Akume, the Chief of Staff to the President, Honorable Femi Gbajabiamila, all our executive governors that are present here today, more importantly, the chairman of the Governor Forum, Governor Abdurrahman Abdurazak. All honorable ministers that are present here today, including the Coordinating Minister for Health, Professor Mohammed Ali Pate. The chairman of the Senate Committee on Health, Dr. Banigo, Chairman of House of Representatives on Health, all honorable state commissioners that are present here today, our permanent secretaries that are present here today, His Royal Highness, the Emir of Sokoto, His Most Grace, the President of the Christian Association of Nigeria, the wives of our governors, our first ladies that are present here today, and all the wives of the honorable ministers of the Federal Republic of Nigeria that are present here today, members of the diplomatic corps, all our development partners, both bilateral and multilateral, directors and staff of the Federal Ministry of Health, all our development partners as well, and members of the press corps, distinguished ladies and gentlemen. It is with great pleasure and pride that I welcome you all to this event as we commemorate the World Universal Health Coverage Day, which marks a major milestone for the health sector in Nigeria. As we unite in the celebrations, we stand shoulder to shoulder with the global community, reaffirming our commitment to ensuring health for all. It is with great privilege that we host this event, graced by the presence of our President, President Bola Ahmed Tinubu, GCFR, all global leaders that are here today, all integral in our collective journey towards accessible, resilient health care system in our country, Nigeria. The theme of this year, Universal Health Care Day, Health for All, Time for Action, reminds us of the urgency and necessity of our endeavors. Today, we mark a pivotal moment in our nation's commitment as we unveil and witness the signing of the Health Renewal Pact, a testament to our dedication to transformative reforms in the health sector. With the support of our esteemed dignitaries, the solidarity of our international partners, we stand poised to turn commitments into actions, translating aspirations into part seeks to bring the federal government, national government, as well as our development partners, both by multilateral, to ensure investment in a shared renewed vision
Thank you very much, the Honorable Minister of State, Dr. Lausa, setting the tone for today. The health sector is multi-sectoral in terms of who you have to work with, departments and all that. So we'll have some goodwill messages, and goodwill message who would deliver the goodwill messages know that they have absolutely 1 minute or 1 minute, 30 minutes. Maximally. Yes, the protocol has been established, and so please do us a very, very warm, making sure that all goes well today. Ensure that please drop the protocol as much as you can and go straight to your message. We're going to start from the community that needs, oftentimes their voices are not heard, nobody knows what they're doing. But representing the CBOs and the non-governmental organizations today is himself a health finance expert who is giving us some measure of innovation on how best to finance healthcare delivery service in Nigeria. Welcome with me, Dr. Gafar Alawode.
Your Excellency, sir, the President and Commander-in-Chief of the Armed Forces of the Federation, the Executive Governors here present, especially the Chair, Governors Forum, my Governor, please permit me to stand on the existing protocol. I represent the Nigerian Universal Health Coverage Forum, which is an assemblage of a wide array of stakeholders, donors, partners, civil society, and CBOs that are committed to supporting the aspiration of government to achieving universal health coverage. Let me use this opportunity to congratulate the Mr. President, the Honorable Minister and Governors and traditional rulers on the occasion of unveiling this narrative-changing blueprint for the health sector and the historical signing of a compact between the national government and the state government that will accelerate implementation of the blueprint. Let me quickly thank Mr. President for prioritizing universal health coverage in his pre-election manifesto and the post-election policy agenda as well. And again, to thank him for giving us very, very vibrant leadership in the health sector in terms of the Honorable Minister, the Minister of State, and the Special Advisor who are well experienced and accomplished in this sector. And again, it doesn't stop there. Mr. President appointed a lot of health personnel in other sectors as well, from sports, from environment, and other sectors, including education, which makes a multi-sectoral collaboration aspiration a feasible one. I would like to thank our governors as well for their commitment to the health, despite the very challenging economic situation they find themselves. However, sir, the largest room in the world is room for improvement. We'd like to use this opportunity to ask for improved spending for health, especially to ensure that the equity fund for health at the state level is released to take care of the poor and the vulnerable. Your Excellency, sir, you have an ambitious goal of leapfrogging health insurance coverage, especially to the poor and the vulnerable. The community have asked me, and the Nigerian Universal Health Coverage Firm have asked me to request, sir, that Your Excellency, this aspiration is a great one, and this is the first time we're having that kind of aspiration. But they've asked me that we have to look at, revisit the financial architecture for health to be able to make that lofty aspiration a reality. They told me to ask you, Your Excellency, that we need an innovative, to consider innovative approach that will help us to pool sizable amount of resources together to be able to expand health insurance to the poor and the vulnerable. They've identified a number of areas, and they asked me specifically, it's not the technical aspect that is not there. They've asked me to please and throw the weight behind this lofty innovative financing, looking at alcohol taxes, telecom taxes, tobacco taxes, and everything. And they are specifically asking for an interministerial committee that will look at these and to mobilize the resources and deploy it. Secondly, they've asked me to make a request for us to increase the accountability bar in the health sector, for the chief executive at the national level and the state level to constantly ask questions about the money being spent on health, how much of health is that money buying, so that all of us will be alive to our responsibility. On a final note, I would like to ask me to assure His Excellency and the governors that the civil society community under the umbrella of the Nigerian USA Forum is with His Excellency at the national level and the state level towards ensuring that their ambitious goal of expanding health insurance to the poor and vulnerable Nigerians, that we are with the government in this process of making history of being the first administration that will put Nigeria on the UAC course. Thank you very much.
Thank you, Dr. Gafar. Quickly, we'll move on to our multilateral partners, and I'd like to start with the World Bank. Can we please have the country rep of the World Bank come up? Thank you. Let's welcome him warmly.
Good morning, Your Excellency, Mr. President. I will listen to Antimoji, and please allow me to stand on existing protocols. I have 1 minute, so let me try to break it up into 5 basic points. First, I think your presence here, thank you for it. It suggests, it clearly reveals, the basic understanding that the future of Nigeria, for the renewed hope that you promise, that you represent, for that to translate into realized potential, every Nigerian child, every Nigerian mother, father has to have access to basic health care. And right now, they do not. As you may know, Your Excellency, Nigeria ranks near the bottom in terms of basic measures of human capital. For a country of Nigeria's potential and size, this cannot stand. This cannot continue. And that was part of, on a personal front, what brought me to Nigeria. When you see the potential, but yet you see the the fact that on a human capital front, Nigeria is ranking so much lower. That was part of what I said, what can we do to help? So that's number one. Second, part of the solution or part of the reason for this has been that government spending on health in Nigeria is amongst the lowest in the world. So clearly, if you even compare to the region, your neighbors, it's 0.8% of GDP, as opposed to other countries where it's up to 3-4% of GDP at a minimum. So there's that imperative. But we know that revenues are low in Nigeria, and over time, those revenues have to be built up. But even with the revenues that you do have, the spending that Nigeria does do, there's lots of opportunities. I love what they said, the largest room in the world, room for improvement. And that's where I turn to Your Excellencies, the governors. I think many of you have heard me say before that almost everything that we at the World Bank do here in Nigeria is really rests in the hands of the states. And governors in Nigeria are among the most powerful elected officials I've seen in any country I've worked. Really, and the states have a huge responsibility for the delivery of basic healthcare, of education, of what matters to most citizens. So what excites me most about this, what we're here to do today, is revisiting, kind of strengthening this compact. In a federation like Nigeria, the compact between the federal, the national, and the states, and actually down to the local governments. And we here as international partners are ready to support that, and we want to be part of it, help in what way we can. It will be important to have it be based on mutual accountability, so it's not just talk. So a warning. Okay. So that's the basic thing. We are here to support you, the World Bank, the rest of the international partners. But this most exciting thing, the key is going to be this compact between the federal and the subnational. It is so important for every child, as I said, every family in Nigeria. Thank you.
Thank you very much, the country rep for the World Bank in Nigeria. And oftentimes people are saying, World Bank, where is the money? It will come. Thank you. We'll quickly go to the UN, the United Nations family, and I'd like to invite the United Nations resident coordinator in Nigeria to please bring his goodwill message. And you can see that they have turned Nigeria.
Thank you very much, Your Excellency, President Bola Ahmed Tinubu, distinguished ladies and gentlemen, and allow me in the interest of time to stand on existing protocol. Mr. President, on behalf of the United Nations, I would like to congratulate you and your government for moving so boldly and swiftly in laying the foundation for bringing health outcomes to scale using a sector-wide approach. For us, health is a human rights issue. As you will know, we've just concluded commemorating 75 years of the Universal Human Rights Declaration, whose Article 25 states, I quote, "Everyone has the right to a standard of living adequate for the health and well-being of himself and his family." It is good to see your government honoring this timeless commitment. Your initiative to renew the health sector showcases that health is not only an outcome of development, but the foundation of social, economic, and political stability and security. We commend the Coordinating Minister for Health and Social Welfare and his team for driving a whole-of-government and a whole-of-society approach. My job includes being a coordinator, so I know how difficult it is to bring everyone into the same direction. Well done. A series of transformative initiatives, including achieving universal health coverage, are an integral part of the cooperation framework that we have signed with government and which we believe is consistent, Mr. President, with your renewed hope agenda. Now, an important game-changing element for us among these transformative initiatives would be to significantly expand health insurance coverage for all, and it is good to see that this is noted as one of the key commitments in the compact. The The UN is also pleased to note the importance given to mutual accountability in the sector-wide approach. We all share a collective responsibility that should transcend individual entities and merge efforts towards the common goal of safeguarding and enhancing the health and well-being of every Nigerian citizen. We welcome the commitment to redesign the Basic Healthcare Provision Fund to effectively revitalize primary healthcare. We also welcome the focus on health industrialization to unlock the value chain of the sector and support job creation and sustainable growth. At the UN General Assembly, where you were, Mr. President, in September, member states, including you, on behalf of Nigeria, recommitted to universal health coverage by endorsing the political declaration. But unless it's implemented, it's just paper. So, Mr. President, I commit the entire UN country team here in Nigeria to support the SWAP and its related compact. Specialized UN agencies, and I'm very pleased that we're joined here this morning by the representatives of the WHO, UNICEF, UNFPA, and UNAIDS, will sign the compact alongside other development partners. Finally, I urge you to see and use the United Nations primarily as a knowledge bank, not a financial bank. Technical assistance emerges as a linchpin in this transformative journey. We will have succeeded to make a difference as UN if the technical expertise and knowledge, as well as good practice examples we can leverage from our global network, is seen and used by you as a catalytic element in your journey to transform the health sector. Allow me to note, like Shubham did, that it is good to see the involvement of governors in this process. We all know that government health services get delivered at the subnational level and by involving communities at the LGA levels. Mr. President, we are committed to being firmly at your side as you build a healthier, fairer, and more resilient future for all Nigerians. Thank you very much.
Thank you very much from the UN family here in Nigeria. And thank you also for your commitment to sustainability. And I'm sure that Mr. President heard you loud and clear about the technicalities that you can bring on. Okay, we would need some financial support as well. But moving on quickly, I'd like to invite our partner, the FCDO, representative of FCDO, please. Here present. Okay, would move to the representative of USAID. Okay, she come in. All right.
Your Excellency, President Tinubu, Your Excellencies, the Governors and Deputy Governors, Honourable Coordinating Minister for Health and Social Welfare, please allow me to stand on existing protocols. This is my first week in Nigeria and my first Goodwill message, and I could not, thank you, and I could not be more delighted that it's at this event. Health is an area that is very close to my heart. It sits, of course, at the centre of a resilient Nigeria, a peaceful and stable Nigeria, and a prosperous Nigeria. And it is central to delivering all the Sustainable Development Goals. We know that without health, children cannot go to school, cannot learn. Without health, people cannot go to work, cannot contribute to a growing economy. And without health, we have nothing. The appointment of Minister Pate, one of the leading global public health experts on the planet, supported by the President's commitment to transforming health for all Nigerians, means that Nigeria, with its extraordinary level of talent and expertise, can fulfill its potential to become an exemplar in bringing down maternal and child deaths and improving health for all. And I would like to say that I am proud that the UK is more than a fair weather friend. Our partnership in Nigeria goes back over 20 years. before I arrived, obviously, and this commitment will continue into the future. In addition to being one of the largest donors to Gavi, the Global Fund, the World Bank, and UN agencies, our latest flagship health programme, LAFIA, will spend up to £235 million over 8 years to support stronger health systems and health security in Nigeria. The sector-wide approach will improve alignment behind government priorities and national ownership, very important, and the UK fully understands that we as development partners will need to change the way that we do things. It may take time. I'm sure it will take further discussion and agreement on mechanisms and modalities and methods, but we are in full support. So, Honourable Coordinating Minister, President Tinubu, we recognise the expectations on you, Minister, could not be higher from the President, from the Nigerian people, and from the world. And we will provide you with every avenue of support to both meet and exceed those expectations. Thank you.
Thank you very much, representative of FCDO, the British government. We are moving on quickly to USAID that have been very much involved, particularly in getting medication for Nigerians living with HIV and needing medication. Please come to the microphone and let's welcome her as she...
Thank you so very much, Your Excellency, Honorable President Tinubu, to the government officials in Nigeria at the federal level, to the state level government officials. Please let me stand on existing protocol. As a DP, we are here today together to acknowledge Universal Health Coverage Day, to fulfill a promise to the Nigerian people, a renewed hope agenda, that the people of this great country will have access to fulfill a range of quality health services without financial hardship. That we acknowledge that the high rates of out-of-pocket expenditures for the average household is unacceptable. So, the theme of this year's UHC Day, Health for All, Time for Action, is an appropriate theme for Nigeria. To the coordinating minister and the government of Nigeria, the United States government extends our heartfelt goodwill and solidarity to you and your colleagues for your hard work and dedication to advance health services. As my colleagues in the development community have said prior to my joining the stage, health is fundamental. It is a human right, and there is no economic development without good health. We further want to commend the government of Nigeria for moving forward with a sector-wide approach. And we are encouraged to see the collective alignment around the Health Compact, which represents our shared responsibility and commitment to ensuring the health and well-being of all Nigerians. You know, as I look around this room, I am so uplifted by the incredible attendance here today. It is acknowledgement that change in the health sector is underway and that we, as development partners, are a part of that change. I am so pleased to see so many of you caring about the lives of Nigerians. So yes, this is a time for action. Yes, this is a renewed hope agenda. Certainly, and this is definitely the radical reorientation of the health sector towards primary health care. And friends, colleagues, this is a time for Nigeria to take center stage to address the issues of maternal mortality, the high rates of stunting, to ensure that every family has access to good quality care. This is, as I like to term, it is Nigeria now. So, this is also a time of the power of partnerships. I want to commend the development partners in this room, led by FCDO as the chair of the Development Consortium, for the work day in, day out, sometimes on weekends as well, under the leadership of the coordinating minister, to think more broadly, to do more. We know what to do. We know what saves lives. We know that every family has rights to good health care. It is not the what, it is really the how. And under the swap, under agreed upon alignment, we will get there together. So, this alignment will create $3 billion in donor contributions over the next 4 years. We will use data more effectively. We will be more efficient in our support. We will be transparent. We will hold each other accountable to the work that we do. It is a privilege, sir, coordinating minister, to be with you, to be on the front lines. And as you always have said, this is a part of us keeping you your job. So we are happy to do that, and we are happy to follow the whole strategy of the New Hope agenda. It is also our agenda as development partners, and on behalf of the United States government, we are aligned with you, we are here with you, and we look forward to our continued collaboration.
Good one. We will be here, we'll be with you, and we would support you all the way. Mr. President, I think you are just lucky that you're making health a priority, and that we also will be here with you. Another round of applause for USAID. We're moving on quickly. 20 years back, the European Union started interventions in Nigeria. We've gone around, we've seen some that have impacted education, health, water, energy, and the rest of it. At this point, I'd like to invite to the podium the EU representative who is going to be speaking on behalf of EU, the head of human development, Leila Ben Amor.
Yes, good morning. Indeed, I'm delivering this message on behalf of the EU ambassador to Nigeria and ECOWAS. Your Excellency, the President, Bola Ahmed Tinubu, President of the Federal Republic of Nigeria, Your Excellencies, the governors of the state of Nigeria, Your Excellency, Governor Abdulrahman Abdulrazak, Executive Governor of Kwara State, Chairman of the Nigeria Governors Forum, Professor Muhammad Ali Pate, Honorable Coordinating Minister for Health and Social Welfare, Honorable Ministers here present, Your Eminence, Muhammad Saad Abubakar, the Sultan of Sokoto, partners, all protocols being observed. The EU, European Union, and its member states welcome this groundbreaking initiative and congratulates the government and the minister, Professor Mohamed Ali Pate, for his strong drive and leadership. In a very short time, his team and the health sector partners were able to deliver a sound, comprehensive, well-thought-out renewal program for the whole sector. This is an initiative that speaks to ownership and accountability. And of course, we are in complete support. As we all know, the health sector in Nigeria has been suffering from fragmentation, underfunding, lack of coordination, while the population needs remained painfully huge. Nigeria should and can have a health system that is robust and caters for all. Social welfare is among our core values, the core values of the European Union. And we have supported health in Nigeria for many years. Most recently by taking the lead in contributing to the COVID basket fund, of course, contributing to immunization by about 160 million euros and COVAX through Gavi, and of course, being one of the major donors to all these multilateral initiatives, as we all know. We are supporting global health as part of the European Union Global Health Strategy. This is key to our commitment to human development throughout the world. In Nigeria, we are looking into implementing with the government new programs on sexual and reproductive health, maternal health, manufacture of vaccines, and other medical technologies in alignment with the EU-AU innovation agenda. Here today, we are again very happy to congratulate again the government on its drive and its commitment. We, as other partners, stand fully with you. And again, thank you.
Thank you very much, Your Excellencies, all very distinguished ladies and gentlemen. At this point, I'd like to invite Global Fund that has been working with the Nigerian government to contain, to reduce, and treat AIDS, TB, and malaria. Global Fund representative, please.
Your Excellency, President Bola Ahmed Tinubu, my friend, the Honourable Coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate, Governors, Senators, distinguished guests, all protocol observed. I can't think of a better place to be celebrating UHC Day than to be here, Your Excellency, to mark this moment. Just over 2 months ago, I was here in Nigeria with Ambassador Nkenga Song of PEPFAR and David Walton, the PMI coordinator, to meet the Honourable Minister, then just 3 weeks into his job. And it is remarkable how much progress has been made. Your Excellency, I'd like to applaud you and your government for the exemplary leadership and commitment in the fight against HIV, TB, and malaria, in strengthening the health system, and accelerating progress towards UHC. This is the way to unleash the extraordinary human capital of Nigeria, this incredible country, freeing even the poorest communities from the burden of disease and unlocking their economic and social potential. As you know, there is a lot to be done. Most strikingly, Nigeria has the highest burden of malaria in the world, accounting for 27% of global malaria cases, 31% of deaths. There has been progress. Malaria prevalence was 42% in 2010 and 22% in 2021. Yet still, close to 4,000 Nigerians die of malaria every single week, and over 90% of those are children under the age of 5. Ending this dreadful death toll and freeing poorest Nigerians from repeated bouts of malaria would be an incredible to be proud of. On HIV, Nigeria ranks third in the world after South Africa and India, with close to 2 million people living with HIV. Yet despite the disruptions from COVID, Nigeria has made really impressive progress in increasing antiretroviral coverage, achieving 90% in 2022. Yet there is no room for complacency, as other countries have learned to their cost. This formidable disease punishes any sense of complacency. On TB, Nigeria ranks first in Africa, sixth in the world. Your Excellency, Nigeria should be proud of the acceleration of progress in fighting TB. TB notifications have more than doubled between 2018 and 2022. Ending these three diseases will save millions of lives and free up capacity in the health system. When I visited Kano in September with the coordinating minister, I was struck by the fact that across the 5 clinics and hospitals we visited, 50 to 80% of the patients were ill with malaria. Just imagine what these health facilities, what these doctors and nurses could be doing for people if they weren't so overwhelmed by this one disease. Over the years, the Global Fund has invested over $4.8 billion in support of Nigeria's efforts to fight HIV, TB, and malaria, and to build a stronger health system. And we have just signed the grants for a further $900 million for the next 3 years. Yet we recognize that these 3 diseases, while hugely important as the deadliest infectious diseases, are only some of the health challenges confronting Nigeria, which is why I congratulate the Minister and his team for the blueprint for the sector-wide approach and the corresponding compact, which we and others will be signing today. The Global Fund recognizes the importance of these vital health reforms and the importance of deep and close collaboration between the federal government and the states, and closer coordination between development partners and the government of Nigeria. It's also why, in addition to the $4.8 billion and the $900 million, we have committed more than $400 million through the COVID-19 response mechanism, first to support Nigeria's emergency COVID response, and now to invest in health system strengthening and pandemic preparedness. And this includes things like 62 oxygen plants across the country, a literal lifesaver for mothers with birth complications, newborns, and anyone suffering from acute trauma. Setting up a genomic sequencing laboratory, refurbishing 22 warehouses, and supporting the coordinating minister's initiative to revamp the model for community healthcare workers. And for the first time, we will also be investing directly in health insurance with an initial $10 million to support schemes in 5 states. Your Excellency, I must commend you and your coordinating minister for your vision and leadership. This today represents a critical milestone in the journey towards UHC and better health for all Nigerians. Of course there will be challenges. Getting to UHC will take more money, more domestic resources, and particularly for primary health care. Turning this vision into reality will require a relentless focus on superb execution. Maximizing impact will entail a sharp and continuous focus on outcomes. Yet, I am confident that under your leadership and with the drive and vision of the coordinating minister and the Minister of State, that you will succeed. For our part, I can assure you that the Global Fund is committed to being your partner on this journey. We will continue to work closely with the coordinating minister and his team to ensure our efforts are seamlessly aligned with the sector-wide approach and to maximize results so that together we deliver for the people of Nigeria. Thank you.
I I was going to send a note of warning for his 1 minute, 30 seconds. But if I take a quick survey in the hall, I am quickly, who has never been affected by malaria or taken ill by malaria? All right, so it's important. It's an important thing that he was speaking to, so I allowed the minutes to pass. We're still on. Goodwill messages with our partners is important. We can't not do this on our own. We need our partners to work fast. And at this moment, I'd like to invite the representative of the Global Vaccines Alliance to come to the podium. I think that's one of the greatest things that science gave to the world. We know that immunization is cost-effective, it works, and so let's welcome the Global Vaccine
Alliance. Your Excellency, Mr. President Bola Ahmed Tinubu, Your Excellencies, Executive Governors, Honorable Commissioners of Health, and Honorable Minister, Coordinating Minister of Health and Social Welfare. Please allow me to stand on existing protocols. I will be very brief. On behalf of Gavi, the Vaccine Alliance, I'm absolutely delighted to be here today to commemorate UHC Day and the unveiling of Nigeria Health Sector Renewal Investment Initiative. Gavi has been working with the government of Nigeria for more than 20 years, and together we have seen great improvements in immunization coverage during that time. But as we know, Nigeria, despite those efforts collectively, is home to the largest number of zero-dose children in the world. But I must say that today we stand here truly with a renewed hope. And we believe that next year, this time, that will absolutely have changed. We have true confidence in the leadership, and we believe that by working collectively and harmonizing all of our efforts, that we can align to build a strong health system that delivers life-saving vaccines to everyone in Nigeria. As you know, there's no greater investment that you can make in public health than the investment in vaccines and in children. And so we stand here today by your side, committed to working with you, the sector-wide approach, and our development partners to ensuring that all Nigerians have access to life-saving vaccines. Congratulations on today and the tremendous efforts that have gone in even such a short time in bringing us here, and for your commitment to health, Mr. President and Honorable Minister. Thank you very much, and wishing you the best.
Thank you, Gavi. We're moving on now to the era of philanthropists who have used their successes in business to help initiate things that will help grow the health systems in Nigeria. And I start with the Dangote Foundation. And I just want all of us to applaud this. This is a man that has moved from not just being partner, but also successfully initiating primary health care, a model in some states, alongside his friends. Dangote Foundation.
Mr. President, Your Excellencies, Honorable Minister Pate, it's fitting that we're here today celebrating Universal Health Coverage Day with this renewed vision of working together on improving health outcomes in Nigeria. The Aliko Dangote Foundation has been focused on health for the past 12, 15 years, and we will continue to do so. Thank you, Mr. President, for prioritizing health and for increasing the budget for health. And I would also like to exhort the states which we work with to also increase funding and release of funds as needed so that we can really make a dent on health. I wanted to say that this compact
gives us confidence that we could all be working together in the same direction with accountability. And I think holding all of us accountable for the commitments that we make is what will get us the results we need. And the last thing that I'll say is the absolute commitment of the Aliko Dangote Foundation to support health outcomes in Nigeria is clear. As a Nigerian organization, we are here for the long term. We live here, we're from here, Nigerians are our brothers and sisters, and whatever needs to be done in the health space, we are here. So thank you very much for inviting us and giving us a platform to express our support to this. And I really look forward to this compact and working even closer with Dr. Pate. Thank you very much.
Another round of applause. Thank you for keeping to the 1 minute. I'd like to call on the representative of Gates Foundation. Thank you. Gates Foundation has been very involved in ensuring that we have technical trainings and beyond that also been part.
Good afternoon, Mr. President, His Excellency, Honorable Coordinating Minister of Health, and please permit me to stand on existing protocols. I bring you greetings from Mr. Bill Gates and Mrs. Melinda French Gates, who have been steadfast partners of Nigeria in the health space for a long time. The Gates Foundation really focuses on two things that get us excited. One is to save lives, and the other is to provide economic opportunity for the least vulnerable in society. Today, we are here for one of those things, really an exciting commitment by Mr. President and the coordinating minister to a set of reforms that are actually going to save lives. And I think it comes at a very opportune time for Nigeria, where unfortunately, still too many women die at childbirth, and still too many children are struggling to survive till the age of 5. So this is what makes us excited about this set of reforms that are being rolled out. We would like to strongly show our support to the coordinating minister and the president. You have shown your commitment, Mr. President, by actually increasing the budget for the health sector, which we commend. And like a lot of my development partner colleagues and have mentioned, we look forward to the states to being able to do the same thing as well. You've heard from the development partners. I think we are all committed with you to be able to rally around and put our resources together towards this important commitment. It is time for Nigeria to do this, and the Gates Foundation is firmly behind you. So thank you once again, and the best of luck, and please be assured of our support, Mr. Minister, as we do this. Thank you.
I'd like to invite quickly the representative of the Buffett Foundation. We're here. Thank you. Shall we please welcome him warmly?
I don't know. Yes. Good morning, everyone. Maybe let me help some.
No. It's for the TV. All right. Okay.
Okay. Good morning, everyone. Thank you, Madam. So my name is Ntayo. I'm here to deliver a remark from Professor Sanait Fasa, the Vice President of the Susan Thompson Buffett Foundation. So allow me to read her message. And she has sent her apologies. Please accept her apologies as well. Your Excellency, Honorable Bola Ahmed Tinubu, President of the Federal Republic of Nigeria, Your Excellency Governor Abdurrahman Abdrazak, Chairman of the Nigerian Governance Forum, Your Excellency Professor Muhammad Ali Pate, Coordinating Minister of Health and Social Welfare, Your Excellencies, State Commissioners, Ambassadors, Heads and Representatives of Development Partners, invited guests, ladies and gentlemen. It's much a privilege and a true honor to be part of this monumental event. With the signing of the Health Sector Renewal Compact, we are all recognizing the importance of accelerating progress toward the aims of the 2014 Health Act of Nigeria. However, we simply cannot achieve the ambitious universal health coverage goal if we don't center the needs of women, girls, and others who are often forgotten or left behind. 70% of maternal deaths globally are concentrated in Africa. Nigeria accounts for 1/4 of the maternal deaths globally. This must change. Nigeria's women and girls need us to deliver on the promises of universal health coverage. We all know that nearly all of these cause of death of maternal mortality are preventable. They are coming from postpartum hemorrhage, unsafe abortion, sepsis, and hypertension in pregnancy. And we know that the solution can be delivered through the primary health care to prevent unintended pregnancies and unsafe abortion and increase births attended by skilled health workers. I and the foundation I lead are proud to join you on this journey. We are fully committed to aligning priorities and harmonizing efforts with the government in support of the Compact's call for a coordinated action through sector-wide approach. I was here in Abuja in October, and I'm so grateful to have had extensive discussions with His Excellency President Tinubu, who continues to be an outstanding leader and champion of universal health coverage at home and globally. I went home with a renewed hope for Nigeria and our continent. I remain hopeful. I'm hopeful that Nigeria will redouble its efforts to reduce maternal mortality. I want to reiterate that I am committed to supporting these important national priorities. Thank you.
We thank you all for the commitment that you've made, partners, going forward. This is important. And I just want us, as we all are here making history, can we please just put our hands together? A very loud one indeed. Because we've had all these partners speaking to the world, as it were. We thank you. Now, since we're supposed to be looking inwards, making sure that we have sustainable plans that will help bring the system in place and stop all these low marks that Nigeria has been given considering health. I'd like now to invite the representative of the African Development Bank. It's in country, in continent. I've been told that in every 4 Africans, 1 will be a Nigerian. So let's hear what the ADB is ready to do in partnership. Please, let's welcome him very, very warmly.
Thank you. Your Excellency, Bola Ahmed Tinubu, GCFR, President of the Federal Republic of Nigeria, distinguished ladies and gentlemen, please allow me to stand on protocol already established. On behalf of the African Development Bank Group, I'm delighted to be here today to commemorate the celebration of the Universal Health Coverage Day and the unveiling of the Nigeria Health Sector Renewal Investment Initiative, which seeks to improve health outcomes at scale using the sector-wide approach. Let me first convey the warm greetings of Dr. Akinwumi Adesina, President of the African Development Bank Group, and applaud His Excellency, President Tinubu, for his clear and bold leadership in approving the implementation of Nigeria's health sector renewal initiative using the swap approach. Can all feel how the mood and the sentiment is so palpable that speaks to the strong spirit and message of the Renewed Hope agenda. We also commend the leadership of the Honorable Minister of Health, Coordinating Minister of Health and Social Welfare, Professor Pate, for the rapid progress and clear vision he has brought to the task of spearheading these reform initiatives, which will drive rapid results in generating the health outputs and outcomes that we desire for all Nigerians. Your Excellency, Nigeria's health sector is faced with many challenges, which became more apparent following the outbreak of the COVID-19 pandemic. These include inadequate quality health infrastructure, weak governance systems and structures, inadequate health financing, fragmented donor support, and underdeveloped supply and value chains. The African Development Bank welcomes the signing of the compact under the Health Sector Renewal Investment Initiative, as it resonates well with our strategy for quality health infrastructure in Africa, which seeks to support regional member countries to develop effective and functional health services delivery systems through the availability of affordable and quality healthcare services, fit-for-purpose infrastructure, including diagnostic facilities, and leveraging digital technologies. The proposed swap resonates very much also with the bank's preference to leverage the use of country systems, working together with partners and governments at the federal and state level to drive reforms and achieve results. So let me conclude, Your Excellency, by assuring of the African Development Bank Group's strong commitment, working together with other development partners, strengthen our collaboration and partnership with the federal government of Nigeria, the states, and other actors to achieve universal health coverage and improve the quality of life for the people of Nigeria and Africa at large. Thank you very much.
Thank you. From the ADB, we're moving on, and moving on swiftly. And we are all noticing the commitment made by all speakers. One institution that has helped the Nigerian health system grow, particularly in reducing maternal and child mortality in this country, is the traditional institution. At the peak days of polio eradication initiative in Nigeria, the traditional rulers are there with us. At the very beginning of HPV vaccines for young girls to reduce cervical cancer, the traditional institution has been part of it. It is on this premise, Your Excellency, everyone here present, I'd like to respectfully invite the Sultan of Sokoto, His Eminence, Muhammadu Saad Abubakar, CFR and MNI, all put together, please invite His Eminence alongside with me.
Let me raise this mic a bit up because Moji spoke last. Your Excellency, Mr. President, I would like to recognize my own governor, the governor of Sokoto State, because nobody recognized him here. So through him, I recognize all governors. Distinguished ladies and gentlemen, Assalamu alaikum wa rahmatullahi wa barakatuh. Today is another historic day. We're all gathered here in this room, in this hall, for a very special program. All of you here have known the role we've been playing as traditional and religious leaders in promoting healthcare delivery in our country. Moji just said a little about that. But I'm not going to say much, but after almost a dozen people have spoken, you find that you don't have nothing more to say. One happy thing I could say here, all the past speakers spoke glowingly about the President's stand on making things differently as far as health issues are concerned. So I'd like to also confirm our total commitment as Muslim leaders, as traditional leaders, happen to be the chairman of the National Council of Traditional Leaders. Our total commitment to this healthcare project, we will give our total commitment 100% so that Nigeria will be a healthy country, because we know health is wealth. The most efficient and very cheap vehicle to convey any message in this country is that vehicle of religion and traditional institution. Because we don't charge consultancy, because all Nigerians, I don't want to be controversial, including Babalaos, believe in God. All Nigerians go to churches and mosques. All Nigerians believe in their religious leaders. So we are the vehicle these country leaders should use to convey any message to those people they are governing. And knowing that what we are supposed to do, I believe we will do our best, 100%, to support every government, federal and state level. Call on us at any time, because we have no other job to do but to ensure the peace and stability of this country, to ensure the religious and temporal needs of our people are met by our leaders. So thank you very much. I also congratulate Professor Pade for bringing this program together and dragging me down here at short notice. But I'm always committed. I'm always ready for any of such jobs that's built around making our people better in this country. Thank you very much. Wassalamu alaikum wa rahmatullahi wa barakatuh.
Thank you very much for your commitment. We'll now call on Commodore A.O. Ayuba, retired Director, National Issues and Social Welfare Association of Nigeria. Thank you, sir.
Your Excellency, President and Commander-in-Chief of the Federal Republic of Nigeria, permit me, sir, to rest on the existing protocol. I'm here to represent Archbishop Daniel Oko, President, Christian Association of Nigeria, who is unavoidably absent. But he has sent me to give felicitations from the CAN Secretariat. He will indeed have loved to be here. CAN is indeed very committed to all social welfare programs in Nigeria, all social intervention programs in Nigeria, and of course, indeed, we have been engaged in several programs in conjunction with the Ministry of Health and the malaria program. We are engaging in the mental health programs that is ongoing right now, and indeed in the UNREAD program, the program on nutrition. So, as it is, we are committed to log on using our elaborate structures in all 36 states of Nigeria, the 6 geopolitical zones of Nigeria, and also we are present in all the local governments of Nigeria. Thank you very much for inviting us, and I would like to assure you on behalf of CAN that we will continue to support the government and do all in our reach to ensure that all efforts that government has brought in to improve the lives of the people of Nigeria will indeed be highly successful. Thank you very much, and God bless you.
Thank you very much. At this moment, Your Excellencies, all present, very, very distinguished ladies and gentlemen. For me to invite the next speaker is an exciting moment, because here is a true Nigerian who sacrificed what the dollar is saying, but came back home. And more importantly, thank Mr. President for giving us a man we know can deliver alongside his brother. On behalf of all of us, distinguished ladies and gentlemen, I'd like to invite the Honorable Coordinating Minister of Health and Social Welfare, Professor Muhammad Ali Pate.
Your Excellency, Mr. President, I crave your indulgence to stand on all the existing protocols clearly laid out. Let me use this occasion to express our profound appreciation to Your Excellency, President Bola Ahmed Tinubu, GCFR, for the incredible and visionary leadership by placing health and social well-being of Nigerians as a key part of your administration's renewed hope agenda. Mr. President, your explications that good health is core to harnessing Nigeria's greatest asset, its human capital, is at the heart of our relentless efforts to ensure that all Nigerians are on path to have access to improved quality healthcare services and without financial hardship. And the significantly increased allocation of federal government's budget to health and social sectors in your proposed 2024 appropriation demonstrate an unprecedented political will and will go a long way in starting to address the financial gaps that have so far limited Nigeria from achieving efficient and equitable and quality healthcare system. Our blueprint under your leadership to save lives, to reduce both physical and financial pain, and produce health for all Nigerians is anchored around Nigeria's progress towards universal health coverage. To improve the population health outcomes, we need to access at affordable prices quality health services. This requires effective governance, coordination, and collaboration between the federal government, state governments, which we have seen here today coming out in full force, our development partners, as well as the citizens and civil society platforms that are also here today. The health sector renewal that we are launching today is a bold effort, a historic window of opportunity, and a call to action to reform and implement the national health system as provided for in the National Health Act, for which your leadership, Mr. President, has provided that boost for us to actualize it. The sector-wide compact is based on our collective recognition that health is, of course, as was mentioned, key to human capital accumulation, key to healthy and economically productive population. And we recognize that there are several challenges affecting the health of our population, and those challenges have been laid out. By signing the compact today, we are agreeing to align our objectives with the priorities articulated in your agenda and in the blueprint that we developed in the sector to improve governance, accountability to our citizens, focus on reversing high maternal, newborn, and child diseases and deaths, unlocking the healthcare value chain through state-directed medical industrialization in partnership with the private sector, and enhancing Nigeria's resilience and health security. We will be adopting a more coordinated approach between the federal government, the state governments, Federal Capital Territory, and all our development partners to achieving the desired improvement in the health of all Nigerians and at the scale that is necessary. Specifically, Your Excellency, we are redesigning the Basic Healthcare Provision Fund, which comprises at least 1% of the Consolidated Revenue Fund provided by the NHA as the foundational basis of the sector-wide approach to do a few things: to ensure more equitable allocation of resources to the poorest and most disadvantaged populations in Nigeria, to mobilize additional development partner financial resources to a common pool or aligned in parallel with the within the sector-wide approach. We expect, and at least we have heard, at least $3 billion in pooled and non-pooled financing in the period 2024 to 2026, which is a huge milestone to be channeled towards improving our primary healthcare system and achieving results for Nigerians. And this represents tremendous contribution from our external partners and your government, Mr. President. But the state governments, where the primary healthcare services will be delivered, we would also expect that they would increase their allocations to health. We expect to double the number of fully functional primary healthcare centers that are receiving the decentralized financing facility for infrastructural upgrades, operational cost, and ensured delivery of high-quality essential PHC package, starting by making the 8,809 facilities fully functional and gradually increasing to 17,000 by 2027 in all the 36 and the FCT, as was directed and signed with you, Mr. President. We will link each of those primary healthcare centers in this effort to a secondary care facility providing comprehensive emergency obstetric care, and to a referral system by progressive development of a national emergency and medical ambulance system. We'll also refine the Vulnerable Group Fund under the National Health Insurance Authority, working with the states, optimizing the risk pools to strategically purchase highest impact benefit package to improve the health with a focus on financial protection. We will move Nigeria closer towards achieving UHC by gradually expanding health insurance coverage through more effective governance and establishing an enabling environment for better public and private sector collaboration. We'll complement the BHCPF financing in the sector-wide program with other public health interventions to reduce the burden of communicable and non-communicable diseases, including malaria, tuberculosis, HIV, strengthening our systems and improving health security. And we'll prioritize the best buy investment in community health models to serve as the critical entry points to public health services in a people-oriented health system. As a first step, we are retraining up to 120,000 frontline health workers all over the country in a collaborative effort between the federal, state governments, local governments, and key development partners, to be followed by an enhanced deployment to those frontline centers. We'll also make transparent to all government, non-governmental partners, civil society organizations, and citizens the resources allocated, released, and the results achieved over time. And while appreciating the tremendous collaboration we have received from excellencies, the executive governors, the Nigerian Governors Forum, all the state commissioners of health, the state primary healthcare agencies, and the state health insurance authorities, including recently at the 64th National Council on Health, where the sector-wide approach was also approved. We call on all state governments and the FCT to complement the efforts of the federal government in the following specific policy actions: to increase their budgetary allocations and timely release of funds for primary healthcare services, immunization, family planning, and public health, and to make those allocations and releases public, to verifiably fulfill jointly agreed counterpart obligations in cash or in kind in support of the BHCPF sector-wide approach to the state primary healthcare agencies and the health insurance authorities, and streamlining the processes for disbursement and accounting of such transfers, to collaborate in exploring innovative financing options, to expand UHC, especially for the poorest Nigerians, potentially including health surcharges and considering the provision of additional health resources as first-line charge from the state portion of the VAT pool, and expanding the training and retraining of qualified workforce dedicated to service delivery at community levels, primary healthcare centers and hospitals, and for the states to also ensure presentation and consideration of routine data on health outputs, the intermediate outcomes on a quarterly basis in their states, state executive councils, the NGF, as well as relevant National Economic Council meetings. And we also ask Your Excellencies, the governors, to add your strong voice, participating in community campaigns and engaging with religious and traditional leaders, as mentioned earlier, in all activities affecting health. On our part, we commit to the establishment of a joint coordination and monitoring mechanism in the sector-wide approach, establishing a common database of all health development partner engagements with the federal government and all the 36 states and FCT, as results scorecard to transparently chart progress on a regular basis and hold each other accountable in bidirectional ways to achieve desired results or change course if necessary. We'll ensure the preparation and presentation of an annual report of the state of health of Nigerians and the national health system as provided for in the National Health Act to Mr. President, to the National Assembly, to the Federal Executive Council and the National Economic Council, and host a joint annual review so that we can review our performance over time. We appreciate that our development partners for all the intense work that they have done with us in the last 3 months and who have now agreed to fully support the sector-wide approach, to provide additional resources, to align behind our priorities, supporting the national leadership and strengthening our institutions and systems where possible, and to reorient their technical and financial assistance to the front ends of service delivery rather than to processes and activities. Complementary to the sector-wide approach to address our prevailing human resource challenges, we are determined to increase the production of health workers by increasing the annual quota of our training institutions, and overproducing health workers will ensure that we have enough pool of trained and competent health workers, even if some are leaving, and exploring managed migration programs through bilateral agreement. Both Nigeria expanding training here at home, because as our young ones live abroad, it will be important that our partners also expand that are.
On behalf of my colleagues, I extend my sincere gratitude to His Excellency President Bola Ahmed Tinubu, whose presence here today exemplifies his unwavering commitment to the political declaration made by the global leaders at the United Nations General Assembly in September 2023. This commitment emphasizes the imperative for key national action at the highest political level to expedite progress towards universal health coverage in 2030. I also extend our warm welcome to our special guest and all the dignitaries seated here today. The highlight of this Universal Health Coverage Day is the signing of the compact between the federal and the state governments on health sector renewal. This significant act underscores our resolve to take action towards attaining universal health coverage. I express our gratitude to the Coordinating Minister for Health and his team for translating and coordinating Mr. President's vision into action through sector-wide approach. We acknowledge that the true measure of our commitment lies in our action. And to this effect, we have just brought here our Commissioners of Health, Executive Secretaries of the State Primary Health Care and Health Insurance Agencies. I think you should rise up as well for recognition when you're seated. So you can see the full commitment from the subnationals. And I'm glad our development partners are also appreciating this. Please sit down, ladies and gentlemen. They carry our mandate to collaborate closely with the Federal Ministry of Health and ensure that the provisions of the compact are translated into practical and measurable actions. The NGF Secretariat, on the other hand, will provide robust support in tracking and implementing the outcomes of this compact. In conclusion, I reaffirm the commitment of the Governors Forum and remain steadfast in its dedication to make universal health coverage a reality for every Nigerian. Thank you very much.
Another round of applause for our governors. We'll be tracking the development, and we pray that this will change. This will bring about the change we need in the health care delivery system. We have a validation from the World Health Organization to say that all that we're doing today is within the context of global practice to ensure a better health indices for Nigeria. I'd like to invite, I'm told that we have the WHO Director General online who will speak for only 2 minutes. He has accepted. We've been trying to put that together. Can we have it quickly, please? And on your behalf, can we please put
Your Excellency, President Bola Ahmed Tinubu, Honorable Senator Goodwill Akapio, Honorable Governor Abdul Rahman Abdul Raza, Honorable Minister Muhammad Ali Pati, Honorable Minister Wali Idun, Honorable Minister Abu Bakr Atiku Bagudu, Honorable Governors, Honorable Ministers, distinguished guests, dear colleagues and friends. It's an honor to address you today, and I'm really sorry I cannot join you in person. I had planned to be with you in Abuja, but I had a medical checkup that my doctors told me could not be moved. And as you know, you should always listen to your doctor, and that's why I couldn't join you. Given that this is a very important event, I really wanted to be with you. Your Excellency, President Tinubu, I offer my warmest congratulations on your election earlier this year. And I look forward to working with you and your government in the months and years ahead. And I thank the Honorable Coordinating Minister of Health and Social Welfare, my brother, Professor Muhammad Pate, for your leadership and partnership for health in so many different capacities over so many years. I commend Your Excellency and your government for your commitment to health reform, demonstrated in the unveiling of the Nigeria Health Sector Renewal Investment Initiative today on Universal Health Coverage Day. It's no exaggeration to say that today could be a turning point for Nigeria and indeed for Africa. The scale of your ambition is a model for other countries, and if implemented, it will send a powerful message throughout our continent that universal health coverage is possible. It can be done. If a country as large and complex as Nigeria can achieve UHC, then anyone can. I'm especially pleased to see that all levels of government and all sectors are represented here today. Governors, senators, ministers, phase leaders, bilateral and multilateral partners, and civil society. You have understood clearly that achieving universal health coverage is not a job for the Ministry of Health alone. It takes a whole of government and whole of society approach. Of course, you're not starting from scratch. You're building on investments and gains in health over many years. Nigeria has many achievements of which to be proud. Interrupting transmission of wild polio virus, managing COVID-19, improving immunization coverage, expanding health insurance, reducing the burden of HIV, malaria and tuberculosis, and responding to multiple disease outbreaks. The Health Renewal Compact that we are signing today is a powerful commitment to build on those achievements. That's especially important as at the current growth rate of 2.5%, the population of Nigeria is predicted to double by 2050. As we always say, universal health coverage is a political choice, and it's a choice you're making. But it's not a choice that's made just on paper. It's made in budget and policy decisions inside and outside the health sector. Most of all, it's made by investing in primary health care, which is the most inclusive, equitable, cost-effective, and efficient path to universal health coverage. In particular, investing in primary health care means investing in the people who deliver it, the health and care workers who are the backbone of every health system. So I welcome the fact that the government of Nigeria is walking the talk with the Health Sector Renewal Investment Initiative. I congratulate you on this initiative with its goals of strengthening governance, improving access to quality care, supporting research and development and local production, and strengthening health security and climate resilience. Making the initiative work requires rigorous implementation and careful monitoring to ensure value for money performance and quality care. Your Excellency, Mr. President, dear colleagues and friends, WHO is proud to have been your partner on this journey so far, working with federal and state ministries of health, development partners, civil society, and the private sector to develop the latest Nigerian country cooperation strategy. I thank WHO's representative in Nigeria, Dr. Walter Kazadi Mulombo, for his leadership, as well as our committed and talented team in the Nigeria country office. I also thank all partners present for their commitment and support. WHO is proud to join you in signing the Health Sector Renewal Compact, and we remain committed to working with all of you on the road towards universal health coverage and a healthier, safer, more equitable, and more prosperous future for all Nigerians. As the Yoruba proverb says, Ilera loro, health is wealth. I thank you.
Wow. Wow. All right. Ilera, so important. Thank you very much. We have the endorsement of the World Health Organization. And going forward, the moment that we have all been waiting for, the endorsement of our president. At this moment, Your Excellencies all, executive governors, Your Excellencies, our fathers, our royal fathers here present, the Secretary to the Government of Nigeria, the Chief of Staff to Mr. President, and indeed all Nigerians, because I've been informed that this has been transmitted live. I would now, on behalf of Nigerians, invite His Excellency, President Bola Tinubu, Ahmed Tinubu, GCFR, Commander-in-Chief of the Armed Forces of the Federal Republic of Nigeria, to address us.
Be seated. Please. Thank you very much. Before I get the stool of the existing protocol, let me recognize our royal father, Sultan. Thank you very much for your presence today, and the representative of Khan. The chairman of Governor's Forum, Your Excellency, you impressed us warmly. All the governors are present. Thank you. The Secretary and many of the members of the cabinet. It is important for me to single out two people in this crusade, and our journey. That is the coordinating minister for health and his partner, Professor Pate and Tunji Alauza. For doing what they are doing since they joined and since the journey started. It was difficult, very lucrative, for these two to serve their country, and they've been doing so positively and aggressively with full commitment and good partnership. You are a very good symbol of what we need in Africa, particularly in Nigeria. Thank the two of you. The honorable ministers, thank you. Team Health for All, time for action. I agree. That's why I'm here. And it gives me great pleasure. Today, as we commemorate the World Universal Health Coverage Day, the occasion marks an opportunity for collective reflection and action as we recommit ourselves to the noble pursuit of health for all. The theme for this year's recommendation, Health for All, time for action, encapsulate the urgency and the determination with which we must approach this noble goal. Health is not merely the absence of disease, but the embodiment of physical, mental, and social well-being. It is a fundamental human right, and Nigerians' commitment to achieving universal health care coverage is reflected in the unwavering dedication of my administration to uphold this right for every individual, young or old, in rural or urban areas. delivering improved quality health. The outcome is an underpinning factor in my promise of renewed hope. That hope is ignited here today, and with your support, all multilateral partners and agencies, health is back on the front burner. Delivering improved quality health is an underpinning factor in my promise of new hope for all Nigerians. I believe that good population health is both a cause as well as a consequence of development. I also know that investment in health accumulation potential demographic dividend. That is why in our 2024 budget proposal, we have increased allocation to health and social welfare as key elements for the nation's human capital development. Recognizing the importance of primary health care as the cornerstone of a resilient, integrated healthcare system, my administration is embarking on massive effort from 2024 to refurb physical infrastructure, equipment, and retraining of frontline health workers in collaboration with all the 36 states. Say again, thank you for your presence, all the governors here today. It's not a political affiliation matter. It's a commitment to the welfare of our people. And we should work together as one single entity. Nigeria with knowledge, people and determination. We will achieve it. We owe people this. It's a promise we made. Campaigning, dancing, ranting, making promises. Here we are. They give us the mandate. All we pledged that we will serve them. Now we must deliver. Yes, we agree that funding and investment in health is the cornerstone of a resilient, integrated healthcare program. Administration will continue to provide universal health coverage for Nigeria. It's our commitment to provided who implemented we understand the importance of well-trained human health resources as valuable in delivering and welfare of health professionals. Of their people. Consider your contributions here at home. As we say, charity begins at home. For the developed countries who benefited from amazing talent of Nigerian health workers, we will encourage them to consider how to support the expansion of training facilities in Nigeria to replace those that they have recruited from here. You should also look at short and long-term opportunity that we offer. Yes, we have vibrant, well-educated society. But we need Nigerians to rise. Those batch us on one side with climate change and drop the earth system to decay. We will rise. Achieving UHC necessitates sustainable financial mechanism. We are committed to exploring innovative financing models, strengthening human healthcare assurance under a recognized, re-energized National Health Insurance Authority. We will do it. And ensuring prudent, transparent, accountable allocation of resources to sustain the program. In this regard, I approved and directed Ministry of Health and Social Welfare to implement a sector-wide approach in all programs to reduce fragmentation and bring coherence, alignment, and improve accountability among government agencies. We must do it. Nigerian citizens, our development partners, will require this. In order to executive decisions, in addition to executive decisions, I have made a support the goal of to save lives and reduce physical and financial pains and produce health that is equitable for all Nigerians. The strategic step we are taking will strengthen the governance of Nigeria's health sector, boost efficiency, reduce leakages, and support the effective implementation of national health. This will improve primary care delivery, boost immunization, health, and promote partners to do if the direction, his commitment and his encouragement and representation here. So you all distinguished guests, you are a testimony to global solidarity and our shared commitment towards advancing universal health coverage. Let me assure you that all Nigeria is fully committed to ensuring progressive attainment of universal access to quality healthcare for all. It is in our hand. It is our commitment. And I'm glad the subnational are here in full force. National Assembly is fully represented. Any amendment that is necessary, we are committed to doing it. Remove the spider webs. I'm glad NAFDAC too is here. I must say I watch your programs. Doing a good job. Thank you. Thank you very much.
Thank you. At this moment, I'd like to invite His Excellency, the leader of the Nigeria Governors Forum. Your Excellency, please can you join at that table for signing? I'd like also to invite...
You've been watching a live coverage from Abuja, where President Bola Ahmed Tinubu has unveiled the Nigeria Health Sector Renewal Investment Initiative as part of efforts aimed at achieving universal health coverage by 2030. The Coordinating Minister of Health and Social Welfare, Mohammed Pate, says the President Bola Tinubu-led administration is determined to deliver equitable and optimal health outcomes for the nation. In his speech, President Tinubu says the initiative will leverage the Basic Healthcare Provision Fund in partnership with state governments and development partners in a transformational sector-wide approach program to improve health outcomes. Today's unveiling also marks the 2023 Universal Health Coverage Day, which is celebrated on 12th December every year.